Here's a great question from the website. Dear Dr. Kleeman, there are many theories about pain and exercise. Some say stop if you have any pain. Others subscribe to the no pain, no gain theory. What is your advice? You know, the important question is, how does one interpret the different types of discomfort or pain that accompany exercise? I think it helps to use those two terms, discomfort and pain, as they represent different messages. The most common types of discomfort or good pain are the so-called burn during exercise that subsides when the exercise is over, and the feeling of fatigue immediately after exercise that again is short-lived and is gone by the next exercise session. On the other hand, let's say you do a new exercise or increase the weight or intensity of a regular exercise. The next day, you can hardly get out of bed with diffuse soreness and stiffness involving the muscles on both sides of the body, the same muscles you were exercising the day before. This condition actually has a name. It's called delayed onset muscle soreness. This is a condition that bridges the gap between a discomfort and a true pain. It's generally felt to represent the tearing of muscle fibrils on a microscopic level. Now, unlike a true injury, there's no bleeding and usually no swelling. In fact, this is how muscles grow bigger, by micro-tearing and rebuilding. In this situation, it's usually okay to keep exercising the sore muscles at a lower intensity, or work around them with the result of being less painful over time, accompanied by growth or hypertrophy of the muscles. Now, if you find it isn't getting better, then you may have to rest the area for a few days until the symptoms subside. Now, contrast that to a different situation where, say, during an exercise, you experience an immediate sharp pain that's concentrated in a small focal area. It may be accompanied by swelling or even bruising. If you try to work through it, the pain intensifies as opposed to subsiding. Now, this represents an injury and should not be ignored. It may be a muscle tear or a tendon pull, but it will need time to heal before you can stress it again. Now, that doesn't mean to stop all exercise, but adapt your program to work around the injured muscle. That way you won't lose ground and have to start all over again. Now, in addition to muscle and tendon injury, pain can be caused by injury to the lining of the joints, called cartilage, or to the bones themselves, a so-called stress fracture. Cartilage injury may cause swelling of the affected joint. The stress fracture, on the other hand, is usually very tender to the touch. One common property of injury pain is that it doesn't go away with rest and will get worse with continued exercise. In a situation like this, you should alert your doctor and have a thorough evaluation by an orthopedic surgeon or a health professional with training in the treatment of sports injuries. So think about the terms discomfort and pain to represent the natural process of strengthening a muscle as opposed to an injury to the same muscle, tendon, bone, or joint. The intensity may be hard to differentiate sometimes, but the distinction is extremely important. And remember, don't fall into the no pain, no gain trap. If you're not sure, talk to your doctor. Remember, if you have questions concerning exercise, health, or life in general, the doctor is in. Just email me at housecalls@thedoctorsworkout.com and I will try to add them to house calls. And as always, stay happy, stay healthy, and stay fit.